What's up, respiratory world? This is our spring-loaded T-piece. This spring-loaded because it pops off and with the nebulizer in line, presses up and allows for direct flow to the patient. You can often leave these in line because when you take the nebulizer out of line, it's spring-loaded, so the spring pops back down into place. Valve adapter is what they consider it by labeling. We usually put these in line in the ventilators. Nebulizer off the machine. This is a component usually used in LTech, long-term acute care facilities. Corrugated tubing to aerosol mask, tray collar, aerosol mask. You can put it in line for the ventilator, and it's for nebulization of nebulized treatments, of our breathing treatments. Sometimes the patient's families will come in and say, this thing popped off and I want to make sure my family member is okay. And which they are, because like I said, it's spring loaded. So when it goes up, you take the nebulizer out of line, it pops back down into place and allows for direct flow. So there's no exhaustion of aerosol therapy from this at any point in time, because when the nebulizer is not in line, it's spring loaded and it's back in place again. And then when nebulizer is in line, you know, it just nebulizes past the spring up piece. These are good, like I said, in LTech facilities. A lot of times in the hospitals, they have the aerogen setups, which is like, you just kind of like set it and you can forget it. It runs for like 10, 15 minutes, 3 minutes. But you have to remember to usually come back and take this out of line. I don't leave them in line because it looks, you know, kind of tacky, and the families don't want to see it like that. So yeah, this is our spring-loaded T-piece. Like I said, for aerosol therapy, for ventilator therapy, you can put it in line. And the BiPAP, I usually put it proximal to the mask so the patient can get more of the nebulizer treatment rather than getting a lot of the treatment stuck in the dead space of the corrugated tubing. Yeah.